Now we're moving into policy and advocacy. On the macro level of our ecological model, these are addressing the largest, using the most powerful approaches we can to influence health. So in brief, let's just talk about the 10 essential public health services. In this figure, you can see on the outside, it's a cyclical process of assessing data to understand patterns and of risk and disease, developing policies, and assuring access and quality to healthcare. And in the center, the different pieces of the pie that are multicolored, we have many different responsibilities, including monitoring health, diagnosing and investigating, informing, educating and empowering, mobilizing community partnerships, developing policies, enforcing laws, linking to provide care, ensuring a competent workforce, and evaluating. So it is all about taking care of the system and managing it. At the core of all we do is research. So when we talk about approaches to policy and advocacy, the purpose of what we're trying to do is to start a movement, increase awareness, and give a voice to a movement to change and result in policies that are stronger and avoid and prevent similar determinants in social structures from creating disparities and being inequitable when applied to populations. So our greatest success stories in public health have resulted from policies, and those have included our tobacco, our safer motor vehicle laws, just the implementation of the click it and ticket laws have dramatically decreased motor vehicle accident death. We have made strides with food safety and vaccinations for children. So how do we get advocacy done and how are we successful? Research. We must design and conduct research of high quality that's sophisticated and unbiased and shows the evidence of what can result when inequitable policies create huge disparities among groups and populations. And we must use research to show that changes in policies can have a positive influence and make the distribution of disease more equitable and less as a result of poor policies that have loopholes or is not equitably applied. And we can also successfully advocate for changes in laws by mobilizing communities and through coordinated, strong, clear, tailored communication. So policymakers, bottom line, need our help. We can't just distill 3 years of a research effort into a few bullet points. We really need to be using multiple channels, multiple messages, using organizations, using all sorts of different ways to tell Congress, both Congress people and senators, about the changes we need and why they're important. So back to the core functions of public health, these were established in 1988 through the Future of Public Health report from the Institute of Medicine, and this really laid out what it established what our focus areas should be, and at the heart of it all, it is to assess and develop policies and assure that they are keeping us safe and preventing epidemics and spread of disease, and helping protect against environmental hazards, as well as helping us prevent injuries, promoting and encouraging health behaviors, helping us respond to natural disasters, and assuring the quality and accessibility of services. So this is where it's really difficult, because we're also living in the United States, which prides itself on its freedom and its individual liberties, and often those are what are at odds. There is a retired professor from the GSU College of Law, and she came to speak to my class in one of the earliest sections, and her presentation was so dynamic about the balance between individual liberties and the protection and promotion of health for a population, and how we want protections, we want a safety net, we want health care, but we also want to do our own thing. We do not like being told what to do. We resist changes to policies, and that is really an important contextual description of what goes on in terms of changing policies. So even when you delve deeper and we go to our health agenda, which is the Healthy People Agenda, right now we're in the 2020, it's renewed every 10 years. The vision is to establish a society which people live long, healthy lives. And our mission is to identify what those priorities are for the health of our nation, to also provide data, research, tools, synthesized science, best practices, evidence-based resources, so that states and the nation and even local level, county level, can address these and learn of opportunities of how they can move forward. And one very important point bolded is to engage multiple sectors. Remember, we're not in this alone. It takes businesses, it takes schools, it takes churches, it takes our neighbors. We cannot do this alone. We all must be involved in strengthening policies to improve practices that are driven by the best available evidence, data, and knowledge that we have. And so research, again, must drive this entire process. Now I want to get into one important professional organization, which is the American Public Health Association, commonly just referred to as APHA. They are our greatest organized advocates for public health issues. They work with key decision makers to make sure that public policy addresses the public health threats of our population. And they keep in mind at the forefront that they're ensuring access to care, protection for core public health programs and services is assured, and that ultimately all that we do is in the spirit of eliminating health disparities. So currently the APHA priorities, they work on very timely issues. A big one, if you go to their website right now, is gun control, but emergency preparedness, food safety, hunger, nutrition, climate change, environmental health, both justice issues, the public health infrastructure and funding, disease control, global health, tobacco control. These are all areas that white papers have been written about, op-eds, different campaigns. And so there's an entire group, it's called FACT Campaign, the Public Health Act. This is a group that their sole purpose is to join members, affiliates, and advocates in educating members of Congress on important public health issues that help to build and maintain healthy communities. So when Congress isn't in session, they will provide tools and insights on how to reach out to congressional leaders so that you can personally support the protection for critical funding for public health agencies. There's the Prevention and Public Health Fund in addressing child health issues, aging issues, impacts of gun violence and prevention. And so not only that, I know so many times we say you have to contact your leadership. And how do we do that? Well, go to APHA's page and see what FACT is doing. They have assembled and created infographics that are amazing, guidance on how to write an op-ed, an editorial to the local newspaper or to some of the big outlets like Newsweek, etc. They help coordinate efforts so that you can, like I said, go and meet and have a personal meeting with your congressperson or senator. They give you state-specific fact information. They help network so that you can get people on board and contact them. Contact your congress member, send this email, this is what it should look like, tips. They will tell you how to get the job done. So they are really on the forefront, like I said, of all the greatest public health threats, many different areas. And that's why I encourage you, while you can as a student, to join APHA. All the things that we've covered and beyond. Just as many topics that are covered in Healthy People, there are groups that and networks in APHA. The annual meeting comes up at the end of October, early November. Please go if you can. This year it's in Denver. It is one of the most dynamic meetings you can ever attend. A student in one of this term's session wrote that one of the topics really reignited the fire she had for a particular interest. And I feel like that is a great way to describe when I do attend APHA meetings, that the fire for public health in my own belly is stoked, and I get so excited to be around so many wonderful, diverse professionals that share common interests. Even though their skill sets may be different, together we're much stronger than we are in a silo. So you can also get further guidance by going to DC. They even include the metro maps of DC to tell you how to get where you need to be so you can, have a successful meeting and hopefully put a bug in our influential decision makers of who makes the policies on the national level. In Georgia, you can, I'll post some links on similar groups. In Georgia, we have a Georgia chapter of the Georgia Public Health Association here, so each state has its own chapter as well. You can get involved with state-specific advocacy and policy efforts as well. So thank you.